The recording and meeting presentation will be posted to the Vision Zero website along with all other Vision Zero related materials, including meeting minutes and upcoming meeting schedules. All panelists will be responsible to mute themselves until they speak. Due to FOIA and public access laws, please refrain from using the chat feature for anything other than our ability to coordinate and help speakers who need assistance using Zoom. The question and answer field at the bottom of the participant pane will be used for public comment. Please refrain from entering public comments into the Q&A field until the public comment portion of the meeting takes place. Public comment will take place at the end of the meeting, and participants can raise their virtual hand to signify a desire to speak and be recognized. Participants may also use the question and answer field at the bottom of the participant pane. In-person comments will be prioritized ahead of those entered into the Q&A field. And with that, I will turn it over to Council Chair, Commissioner Ugliva.
Thanks, Aaron. Good morning, everyone. Really quickly, just want to give welcome to everyone. Thank you for joining us on a very what's going to be a very hot, muggy day. Maybe that will lead to more people joining us and staying in the air conditioning. So we do have, I think, a new member or semi-new member joining us today from one of our participants, Nancy Chupak, I believe is on, who is in place of Jackie McMahon. Nancy, I don't know if you want to introduce yourself.
Thank you. Yes, I am Nancy Chupak. I'm a senior assistant state's attorney with the Office of the Chief State's Attorney in Rocky Hill, Connecticut. And I am filling in for Jackie. I'm actually going to be taking over Jackie's position as the traffic resource safety officer come July 1st. Great.
I'm glad to have you in the role. We rely really heavily on the TSRP, so we'll be working really closely with you. Okay. And first order of business is the adoption of the minutes from March 27th, 2024. Aaron sent those out to everyone in advance of the meeting. Any questions or objections to adoption of the minutes? Can I have someone move to adopt the minutes?
Hey, Garrett, this is John Slipka. Move to adopt.
Okay, thanks, John. Okay. Anyone opposed to adoption? Seeing none, I will take that as an affirmative yes to adopting the minutes. Okay. So we can move on to the meat of the meeting. Today's meeting agenda is entirely focused on one of the major issues on our roadway today, which is impaired driving. So I think anyone who has paid attention to the news sees what's going on our roadways. There is an increase in speeding on our roadways, excessive speeding, but also we continue to have a crisis of impaired driving on our roadways. Connecticut historically has one of the highest rates of impaired driving in the nation. So we felt we wanted to dedicate today's meeting to that issue. Pulling in a few different parts of state government to talk about what they're working on in the space of impairment, whether it is addiction issues or what we see from the DOT side, which is the crash data, or on the sale of liquor. So really going to have a broad scope discussion here. When I talk about this issue of impairment, whether it is from alcohol.
I haven't heard back from her yet. She's just woke up.
Oh, Natasha is unmuted, so we'll.
Sorry.
It's okay. The big thing is, focusing on impairment and ensuring people understand that we also can help others. I think many of us have had family members who have suffered through impairment issues or addiction issues. So I think many of us have seen what addiction can do to families, to individuals, and have tried to support individuals through that effort to try and fight through those efforts. So This is going to be a broad scope discussion focusing on many different topics related to impairment and maybe some of the causes behind impairment. So with that, very packed agenda. So I'm going to ask our speakers to keep focused and keep moving on in your presentation. So we're going to start with Flavia Pereira, who is a supervising planner here at DOT. Flavia? Okay, Flavia, if you are talking, you are muted.
Can you hear me now?
Yes, we can.
Sorry about that. So as the commissioner said, I work a lot with the crash data in the highway safety office at the Connecticut DOT. It's a packed agenda, so I'm not gonna take too much time. But Erin, if you can advance to the next slide. Okay, so this slide basically shows you or gives you a good overview of our crash statistics for impaired or alcohol or drug impaired driving. The table on the left-hand side actually shows you our total number of crashes, which is around 100,000 every year. And impaired driving crashes are roughly around 3,000 of those 100,000 crashes. So it seems like we have been quite consistent for the past several years with 3% of our crashes being related to impaired driving. But if you look at the table on the right-hand side, it more specifically focuses just on the fatalities. And you will see that of the total fatalities, our impaired driving fatalities are a huge percentage. They range from 35 to around 43, 45%. So it's a very big chunk or a lot of people involved with fatal crashes are impaired. And that's a very significant number. And I will get back more to the details on alcohol impaired fatalities later on in my presentation. But I'll give you a bit more overall overview in the first couple of slides. Next one, please. So this slide shows you just all the injuries, the different kind of injuries, the serious injuries, minor injuries, also no injury crashes, which are property damage only crashes. And those crashes generally are much higher percentage. But if you look at just the different numbers over the years, you can see that the injury crashes have remained pretty much stable or they have declined slightly. 2024 is still an incomplete year, so it's of course going to be much less, but they have remained pretty consistent throughout the year. And as we saw in the previous slide, our overall impaired driving related crashes are around 3% over the past couple of years. But I do want to mention that we do have 40 to 45% testing refusal rate in Connecticut, which is a significant number. So when you look at this data, please keep that at the back of your mind. It's a significant number for refusals. Next slide, please. So generally, most of the impaired driving crashes, we see them start around 6 o'clock in the evening, and they continue to about 2 o'clock, 3 o'clock in the morning. The peak is around 9 to midnight, but that's generally when we see most of our impaired driving crashes. And the crashes are generally, they tend to be more during the weekends, as you can see in the second graphic, Friday, Saturday, Sunday, into early Monday morning. Next slide, please. Month of the year, generally we see a peak in the month of May, probably because of some of the holidays that come up, Memorial Day weekend and things like that. And there is a much higher peak during the winter months, the winter holidays, during the December, January time period. We do also see a peak in October, which I don't really know why. Maybe it's Oktoberfest, I don't know, or if it's maybe the beginning of the days get smaller and people try to cope up with that with a little bit of alcohol or stuff like that. So I'm not exactly sure why. I don't have a very good explanation for it, but we also do see a peak around October for impaired driving crashes. And you will see that most of these crashes are on the local road. A majority of these crashes occur on local roads, followed by the state roads and then the interstate. So, generally the general consensus, at least out in the literature, is that people are more apt to drinking and driving when they are closer to their home. And that could be a factor why we see more of the impaired driving crashes on local roads. Next slide, please. This graphic shows you a distribution of the age group and the gender. Generally, we do see a peak or, the age group of 21 to about 37, 38, where there is a huge peak of impaired driving crashes, and generally about 75% or so are males compared to females that are involved in impaired driving crashes. Next slide, please. Before I talk about this slide, I kind of want to apologize a little bit. This is a little bit of an older data, and we didn't have enough time to get this updated to the most current data. But it kind of points out an important thing. Generally, we see most of the alcohol-impaired fatality and serious injury crashes in the western half of the state compared to the eastern half. The yellow dots are serious injuries, and the pink, red dots show the fatalities. And you will notice that a lot of these crashes are generally located in and around our major cities: Hartford, Bridgeport, Waterbury, things like that, Danbury. The blue polygons actually indicate some of our underserved communities in the state. And you will also notice that a lot of these crashes coincide with the underserved communities. Again, major cities of Hartford, Bridgeport, Waterbury, New Haven. There's also Danbury, Meriden, Norwalk, good amount. There's good, even in the Stamford area. So you will see a lot of these crashes in the western half of the state, again, localized or more concentrated in communities that are, considered underserved. Next slide, please. So moving on more or focusing on the fatalities and especially the alcohol-impaired fatalities. And this is the data from NHTSA that was published for 2022. Connecticut continues to rank in the top 10 nationally. In 2022, we are actually much better at 35%, because as I mentioned in my first slide, we have ranged from 35% to 43, 45%. So this year, 2022, we have done a little bit better as far as alcohol-impaired fatalities, but still we are much above the national average of 32%. And this is, again, 0.08 BAC and above. So this is a good comparison that you can get for where we stand nationally. One thing I want to kind of mention here is when NHTSA computes the alcohol-impaired fatalities, they use an imputation model. So for example, if there are cases where we have not been able to submit data, toxicology data or things like that, they will use certain other parameters from the crashes, like the time of the crash, the speed of that's known at the time of the crash, the gender and things like that to determine whether it might be an alcohol-impaired crash. So generally, NHTSA's numbers are imputed numbers, and you'll see them a little bit higher than our, in-house numbers because of that imputation model. Again, I want to mention NHTSA does very thorough QC on all of the fatal data that we submit, and their data usually lags about 2 years behind. So 2022 is the latest data that they have published so far. The next year's data will be forthcoming as per their schedule. And you will notice that some of these numbers, like the 35%, might be a little bit different from the next slide that I'm gonna show, which is more of our computation based on the internal toxicology results that we have. So this particular graph shows you alcohol impaired fatalities, and this is strictly based off of the toxicology results that we get here in our state. So driver toxicology results for these, again, these are just the drivers that are killed, that were killed and had the positive alcohol results. Again, any alcohol amount, not just 0.08 or above, but any alcohol in the system. And this is over, you can see that over the past couple of years, it has ranged between 32 to 43%. Next slide, please. So this slide breaks it down further and shows you the different concentrations in there. And you'll notice that about 50% there was no alcohol detected. We also had about 16% with no results. But the ones with the positive alcohol results, you will notice that majority of those are between 0.08 to 0.15 and above, and a lot of them 0.15 and above, 23%. So that's a huge, this is more than almost double the legal limit of alcohol of BSE 0.08. So that's a concerning factor. It's a major chunk. So basically the impaired driving fatals that we are seeing, most of them are above or twice the legal limit of alcohol. Next slide, please. So we wanted to kind of also bring together, a little bit about the cannabis as well, because that is a concern with legalization of cannabis here. And these results just show over the couple of years, the positive cannabis in the drivers killed only, not passengers or anything, it's just the drivers. And you will see that it has there was a peak during the pandemic time, 2020 and 2021. And then after the 2021 year, it has kind of remained stable around that 31% of 31%, but most of the peak was around the 2020, 2021 time period. Next slide, please. And this slide actually breaks it down based on the concentration. Again, you will notice most of them, 53%, there was no cannabis detected in these drivers. We also have some no results available thing. And then we kind of have divided into, less than 5 nanogram of delta-9 THC or greater than 5 nanogram. It's just based off of the fact that Colorado, which is the only state who have a law stating that about 5 nanogram delta-9 THC equals DUI. So we kind of use that as a reference, but you will notice about 30% of the drivers with delta-9 THC, whether it's about 5 nanogram or under 5 nanogram. Sometimes we are not able to detect the delta-9, but it's the metabolites, which is the carboxy or the hydroxy THC, and it does indicate presence of cannabis, but it's just that it's not delta-9, it's the metabolites, and that's a small percentage with 2%. But overall, you'll see about the 31% of drivers with cannabis in their system. Again, I do want to emphasize and mention that presence of drugs, not just cannabis, any drug does not imply impairment, because unlike alcohol, where the legal limit is set at BSE of 0.08, there is no legal limit for any of the drugs set. So even if there is presence of cannabis in the system or any other drug in the system, we cannot always imply that they are impaired because of the drug, unless there's DRE evaluation to back that up. So next slide, please. And the next slide, this one shows you the alcohol and the cannabis combined. And in this case, we looked at alcohol of 0.08 and any amount of cannabis in the system. And you can see, generally about 15%, approximately around 15% is what you see the drivers having both cannabis and alcohol in the system. And the next slide actually breaks it down for you further. This one shows, about 15 to 16% of the drivers having both cannabis and alcohol in their system. Again, it's alcohol above 0.08, so they're definitely impaired with alcohol, but they do have cannabis in their system as well. And the cannabis only is about 14%. Alcohol only, again, that's just any alcohol, not about 0.08, but presence of alcohol, 21%. So you can see the breakdown of the different categories with this chart. Again, I do want to emphasize that we cannot imply impairment just based on cannabis alone. All right, next slide, please. So, this has been a very hot topic with wrong way fatal crashes. We saw a very, very significant increase, about a 500% increase in 2022 with the wrong way crashes. There were 23 fatalities in 2022, and you can see from 2018 to 2024, that was a very high number compared to any of the other year. 2024, we are again seeing it's only half of the year so far, and we have seen there is an increase compared to 2023 again. But one thing I do want to mention is most of these drivers that were involved in the wrong way crashes they were impaired. They had, either alcohol in their system or some other drugs in their system. Some of the results, we don't have them because they were not tested, or if there are surviving drivers and, ongoing litigation, we don't always get those results. So, you can see the numbers of percentage of drivers with alcohol and BAC might be not 100%, but most of these drivers were impaired in these wrong way fatal crashes. So with that, I can take any questions if you have.
Thank you, Flavia. I was waiting to see if anyone raised a hand to ask any questions. This is intended to set the baseline for the other presentations we're going to have. So I see Susan has your hand up.
Yes, I was looking at your map with the yellow dots for non-fatal and the pink dots for fatal. And I do see a lot of the yellow dots coming up kind of like in the major cities, up like 91, 95 along the way. Yes. I do notice though that in the the eastern part of the state, there doesn't seem to be a lot of non-fatal crashes, but there seems to be a higher prevalence of fatal crashes.
You're right. Sorry.
Yeah, go ahead.
You're right about that. If you consider the rate of fatalities per 100,000 population, the Windham County is at the top of, for the fatality rate for impaired driving.
Mm-hmm. Do you have any thoughts about why that might be?
It could be because there is, speeding might be an issue there because it's not as densely populated as the other pods, but, that could be one of the reasons why we are seeing more fatal crashes there because, you think later in the night there's not going to be much people around and people may not be paying attention. That's kind of just a wild guess. I don't have, a confirmation about that. But yes, I do agree that the fatality rate is much higher in Windham County.
Yeah, thank you.
Okay. Any other questions on the data side? None. Thank you, Flavia. And for those of you who have never met Flavia before, she is a wizard with all of our crash data and everything we do here in our Highway Safety Office. So thank you, Flavia.
Thank you, Commissioner.
Okay, so we're going to move on to our next presenter. Caitlin Anderson is the director of the Liquor Control Division at the Department of Consumer Protection. And so wanted to hear an update on what DCP does to focus on impairment and impairment behind the wheel as well. So Caitlin, if you can unmute and take it from there.
Good morning. Can you hear me and see me?
Yes.
Great. Wonderful. So thank you for having me today. Again, my name is Caitlin Anderson, and I am the Director of Liquor Control for the state of Connecticut here at the Department of Consumer Protection. I'm going to talk briefly about our role in investigating and administratively prosecuting drunk driving accidents. So next slide. So briefly, we are part of the Department of Consumer Protection, which is a larger agency. You want to go to the next slide. DCP's primary role is to issue licenses, and by issuing licenses, we end up regulating everything from alcohol to pharmacies, all forms of marijuana, home improvement contractors, electricians, plumbers, lotto, casinos, real estate, and everything else, basically, so much more in between. And the agency's overall goal is to ensure a fair and equitable marketplace and safe products and services in those industries that we regulate. So that Liquor Control's mission is built off that. If you go to the next slide. Our primary goal is to safeguard public health and safety for individuals who choose to consume alcoholic beverages. And that's not only safety in roads, but also safety in the premise, integrity of the alcoholic beverage product, and making sure that consumption is moderated. We do that through licensing all aspects of the alcohol distribution chain. You may have heard the phrase three-tier system before. Connecticut is what's called a three-tier state. Think of New Hampshire, for example. That would be called a control state. And that's where the state owns and manages part of the alcohol distribution chain. So if you've ever purchased alcohol at a retail store in New Hampshire, you're actually buying it from the state. In Connecticut, all of that is privatized through the three-tier system. So we start with the manufacturer or the supplier. We then have a wholesaler in the middle. And lastly, we have the retailer. And by creating the three-tier system after Prohibition, the thought was to break up the flow of alcohol from manufacturers to individuals. A big problem leading to Prohibition was something called the Tied House, which is where the manufacturers would own and control their own bars and basically give away alcohol to get people addicted to the substance, therefore increasing their sales in the end. The three-tier system is designed to break up that connection and introduce regulation and sort of inefficiencies in the flow of alcohol from a manufacturer to a retailer. Modern alcohol manufacturing today, though, is a little bit different. We do have the wineries and the breweries that are allowed to serve their own products, but within the framework of the three-tier system, they are still equally as regulated. So we license all players in that three-tier system, and we also license all the brands that you see for sale in Connecticut to ensure their integrity, and we also maintain the price control system for the state as well. Go to the next slide. So in doing all of that, we have two core functions. First is our licensing function, and then secondary, our enforcement. And while I'm not here to talk in depth about licensing, that's really the base of everything that we do. The license is what creates our ability to do that enforcement. And our main goal when we are doing licensing is to ensure that the business is licensed appropriately. So specific rules and regulations that need to apply actually do apply and connect to that license. So for example, we license restaurants and bars, which we would call on-premise consumption because the consumer is having their alcohol where they're purchasing it. Package stores and grocery stores in Connecticut are what we call off-premise because the consumer is taking their product and supposed to be drinking it at home. Those basic core licensing functions are what give rise to our various enforcement violations. So on the right, you'll see those are our bread and butter violations. Those tend to be what make up the majority of our enforcement work here in Connecticut. So you'll see sales to minor, sales to intoxicated persons, hour and day violations, safety violations, and then general unlawful conduct. So things like fights, unfortunately, drugs, things of that nature occurring in permitted premises. The next slide. So I'm going to focus most of my comments on enforcement and how we can assist areas locally and what we are doing and sort of maintaining at the state level. And I'm going to tailor this specifically to intoxicated driving. While we don't have an intoxicating driving charge that we can levy administratively, we also can't go after the person who did the consumption and the driving. Our ability to help is with regards to the premise that made the sale or served the alcohol to the individual. If you go to the next slide, you will see a map. The way we handle enforcement in liquor control is we divide the state into two areas. These areas are selected because they actually have the same, more or less, permit density. More or less the same number of permits are in Area 1 as in Area 2. So it's actually really interesting to consider this in regards to the map that showed the fatalities and serious driving incidents. I was a little surprised to see so many in what I would consider Area 2, just knowing that the density is a little bit higher in Area 1. So just food for thought as we're thinking, sort of about what the data represents here. So Area 1 and Area 2 are roughly equal in permit density, and teams of agents are assigned to each location. I do have one agent with statewide assignment to handle broader cases, but assigning agents into individual areas really allows our teams to learn those local nuances and local specifics of each town and city, and it allows them to sort of generate relationships with local police, and all that helps us to be more effective when we are doing investigations. So go to the next slide. So in case anyone wants to contact us directly, and more specifically the enforcement supervisor for any particular part of the state, I provided their contact information here. We can also take general complaints or general inquiries via our inbox. We also have an agent on duty manning a phone line every single day, and we do take anonymous complaints or inquiries as well. So remember, obviously, I think most of us are state agencies here. Freedom of information does apply. So even though you may want us to keep something confidential, if something is requested via FOIA and has a name on it, we are required to turn it over. So next slide, please. Okay, so the beginning of any enforcement investigation is determining our jurisdiction. We only have jurisdiction over locations with an active liquor permit or, thanks to recent law changes, where an application is pending. The sale of alcohol without a permit is a criminal matter. We do not have jurisdiction. That's why I was stressing licensing, and my licensing is so important for us because that is what creates our jurisdiction. We do not regulate BYOB in any capacity. We get that question a lot. If there's a BYOB at a permitted premise, we have certain procedures and rules we recommend, but we don't regulate that alcohol that is BYOB. We also do not regulate social hosts, so private parties or people who consume within their home privately and then get into a car and drive. We have no jurisdiction over that social host. There's one caveat to that. It's graduation season and party season and wedding season, and say you attend a large party at someone's home and they've hired a caterer. That caterer has a standing liquor permit. We would have some jurisdiction over that caterer and their service of any alcohol. So one caveat to keep in mind if it is a social host situation. You go to the next slide, please. All of our licensing data and status is available online in real time if anyone wants to verify whether a premise is permitted or not. And there's two tools I recommend if you go to the public-facing side of eLicense. Some of you may be familiar with eLicense and how we use it internally, but if you go to the public-facing side of it, I would suggest you can look up a license or generate rosters. And if you can go to the next slide, this is if you wanted to look up a specific license. One caveat for anyone not familiar with the system is it's very finicky. So if you're looking to see if Joe's Bar at 123 Main Street in Hartford has a permit, you need to enter Main Street exactly how it would be in our files. So you don't know if it's spelled out fully street or if it's ST or STR or if there's a period. So my recommendation is usually start broad, less is more when you're doing searches, and then try to narrow it down. Similarly, if you go to the next page, you can pull general rosters that will go print into Excel, and then you can kind of sort the data and play with various locations and towns and cities and see how many permits and what types of permits are in each location, and sort of get that higher level data available to you. Okay, next slide, if you don't mind. All right, so I'm going to talk, last topic I'll cover is various types of enforcement, and I'm going to focus on charges and enforcement that either directly or indirectly relate to drunk driving, intoxicated driving. So the first one's obvious, you know, a sale to a minor or sale to intoxicated person. We can do these types of investigations for both on-premise locations, and they do come up in off-premise locations. On-premise, that's sort of, I think, what we all stereotypically kind of imagine as someone's consumed too much at a bar and then gotten into a car and driven. The off-premise context is someone is already intoxicated and goes into the package store or grocery store, buys more product, and then gets in the car and drives. We can do stings, and we can do this at request. If we do a sting for a sale to an intoxicated person, for ethical reasons, we can't just get somebody drunk and send them into a location to see if they can then purchase alcohol. We usually set up surveillance of a particular location, and agents are trained to watch individuals going in, watch what they come out, what they're carrying. Sometimes an agent will be inside observing what's going on. They tend to be going undercover and sort of doing surveillance work for these sale to intoxicated person charges. And again, we can do these at requests of the town or to follow up on complaints that we receive from members of the public. Hours and days, and again, this is sort of interesting considering the data. And when there were the highest number of crashes occurring on the road. Again, we can do this in either on-premise or off-premise, at stings or at request, but there are standard closing hours and closing times for all premises. And we often work with premises for on-premise locations that have an issue with going beyond the set state hours, and work with them on instituting gradual last call procedures to encourage people to leave earlier and get out of the premise at a sort of more steady rate, so we don't see that mass rush of everybody leaving or that mass rush of everyone trying to consume one last drink and then immediately walking out the door. So the hours and days violations are helpful for helping us work with places that do have these kinds of problems and sort of poor crowd control management. And then we'll also generally investigate quality of life concerns. These require a lot of coordination on our part and also with the local town where we'll be working. and it's generally related to some other kind of violation, whether it is sale to minor intoxicated persons or hours or days. But think your general local business that's really bringing the neighborhood down kind of a thing. It can either be an on-premise or an off-premise location, but for whatever reason, they're not being good corporate business neighbors, and there's a lot of problems or issues surrounding that one premise. We can help and unpack that to see if we can pinpoint where the problems are and if it is related to a sale to intoxicated person. Okay, next slide, please. And I just want to break down a sale to intoxicated person charge in a little more detail. These are, unfortunately, some of our most difficult cases to prove, given that intoxication is so subjective and every person displays signs of intoxication uniquely. In order to prove the charge, we would have to show that, one, the person was served and the person was showing signs of intoxication at the time of service, or that the quantity of service was negligent such that intoxication was going to be inevitable. I think you can appreciate that those are difficult standards for us to clearly prove by the burdens we need administratively. In reviewing these kinds of cases, we'll always check for surveillance cameras. We'll try to get eyewitness statements. We pull bar tabs. We try to get credit card statements, all that, to see if we can piece together how that person was acting at the time of service and what they actually consumed while at the premise. There are a few types of problems with these cases, and often they get derailed for one of these reasons. We can't pinpoint the drinking trail. The individual was hopping locations or going back and forth between bars, and we can't figure out where the drinks were served during their sort of consumption period. Someone else is ordering the drinks. Under state law, one person is able to receive 2 beverages. So, a friend can go up to the bar, order, get 2 drinks, take it back to the person, and then the premise has never seen or is aware that a person who is intoxicated is receiving the drink. Cash payments are a problem. Then we can't put together all those receipts necessarily or pinpoint which receipt belongs to which patron. No visible signs of intoxication. We can pull tapes and, internal TV recordings or even social media videos and recordings that we can check. And it's difficult to see that the person is actually intoxicated. Say they hold their liquor well. Similarly, the pregame is a problem. Someone drank before entering a premise and they aren't yet showing those signs of intoxication, so they're able to successfully order a beverage, and that could be what puts them over the edge. Very difficult in those circumstances as well. Other problem, and this happens more often than you would imagine, at least from our perspective, that the person left the bar but continued drinking outside of the bar. So it's then very difficult for us to show or demonstrate that the intoxication happened at the bar or at that location, because it could have happened after the person left when they kept consuming alcohol. Next slide, please. So tips for successful referrals of these types of cases to us. One, we can only investigate what we know about. It can be a little surprising from my perspective that we aren't often notified when there is a drunk driving crash. First thing is notify us, tell us, we'll see what we can do to help. The second is to be timely. Often, and I understand that police investigations do take time, lawsuits, etc. But the sooner we know, the more help we can be. And we have certain investigatory tools in our tool belt that we can use to try to help or augment an investigation into whether or not the drinking happened at a specific premise, and provide us as much information as possible. And the more we know, the more we can help and the faster we can help. So those are sort of the best resources I can offer for helping us help an investigation into drunk driving. But even if it's later or all the information isn't we can't pinpoint all of it. There is still value in reporting it to us because we do keep records and files on all locations. It can sort of start to create a paper trail of a particular premise, tying back to those quality of life cases. If we get complaints, it's helpful for us to be able to go back and say, well, we weren't able to substantiate charges, but we had 3 other complaints for sale to an intoxicated person or a minor. That shows something. Where there's smoke, there tends to be fire. It can help in other types of administrative proceedings, something called a remonstrance, which is a case brought by the public against a premise, and all of that information can be very useful to a remonstrance case. Or if something incredibly egregious happens and we're asked to do a summary suspension, an immediate suspension of the permit for the public health and safety reasons, it's helpful if we can look back in our files and see that there is some sort of history at this premise and there are known issues. So all that being said, while they are difficult cases for us to prove, we do still want to know about them. We will still do our due best to investigate and see what we can learn. And we still want to be able to keep those records and maintain them administratively. All right, so last slide. I am happy to take any questions that anyone might have or explain anything in any further detail.
Thank you, Caitlin. I'll start with one quick question, which is, I was surprised. So my understanding is Connecticut does not have any required training for servers or
Correct.
bartenders, right? Is that true?
That is true. We do not have any mandated training for bartenders or servers. One thing I have been working on is trying to actually create a training program for our permittees to make part of the licensing process. We're still in the beginning stages of that, but it's something I've been exploring with Demas and actually some individuals from DOT, seeing if we can get a joint training program off the ground and at least make sure our permit holders have some training and understand more their roles and responsibilities.
Okay, great. Susan.
Any other
Yes,
questions?
thank you. Nice presentation, Caitlin. I do have a question. You're talking about being notified about an injury or a fatal
Mhm.
crash related to alcohol or drugs, actually alcohol in this case. Do you get notifications from the medical examiner's office after
I
they've done
can't think of one.
toxicology?
I can't think of one, no.
Okay, interesting.
Our notifications usually will come from the police.
Mhm.
And given the number of accidents we've just learned about, I would say that our notice is a fraction, small percentage of what's obviously going on our roads.
That's interesting. So another way that you could probably go through this, and I know Flavia was going through some of this data because she does get the death certificate data. So there is the death certificates, whether or not that person died from a motor vehicle traffic, and also some particular, like a list of different types of substances that were found in their toxicology, probably associated with their death.
Mm-hmm.
So
Yeah,
that's another
that would be
source.
interesting. Certainly a source of data for us. It's curious whether or not we would then be able to link that with, like, yes, they had been drinking at a bar. So we would still be interested in that police and criminal investigation. So we could realize whether it was a social host over whom we have no jurisdiction or if it was someone coming from a permitted premise.
Okay, thank you.
Yeah, and Caitlin, thinking about Flavia touched on the wrong way driving piece and what we did to identify the top 250 most at-risk wrong ramps in the state on our highways was we looked at multiple factors, and one of which was proximity to an alcohol serving establishment, whether restaurant, bar, hotel, or banquet hall.
Yeah.
And then actually we've been getting alerts, and some ramps are more frequent than others in terms of alerts. So I think I'd like my team to sit with your team to talk about what we're seeing and frequency at certain locations, because it's clear, like in our mind, not being experts in this field in terms of liquor control, we're able to say oh, okay, there must have been an event at that location because we had multiple in one night at that location, so.
Yeah, that would be interesting for us to know. And again, I mean, we got something like that, you know, hey, we had multiple driving incidents in this area around this bar. Well, we could certainly reach out to local police to see had they responded to anything, and also go to that premise and just directly follow up with them ourselves as well.
Yep.
One thing I meant to say, and I didn't, is I noticed in the data, October, May, and December were some of the highest months for accidents. December's obvious with all the holiday parties. But I'll note for you, October, you have Columbus Day, sort of that last fling, end of summer, Halloween, and some Oktoberfests beginning. So we actually tend to see a lot of products go lower during the month of October because they're trying to generate sales for those events. And also May, you have Memorial Day, the start of the summer, and a lot of graduation parties and celebrations right now, wrapping up into June. So just flagging that we see a lot around that time too.
Yep. Yep. Alexander.
Hello, again, Alex Intron from State Police. I just wanted to add real quick from personal experience. So when I was in charge of Troop F down in Westbrook, we did have a case with a sketchy business selling cannabis products to particularly high school students. So we worked well with consumer protection. I hate to say it, but there's sometimes a lot of red tape on our end that we can't get through that maybe they can finagle through. And also we worked with revenue services. Now revenue services, surprisingly, their threshold for getting gaining physical access to some of the locations or documentation or something is way lower than ours. So we, as a trifecta of state agencies, we really went in there. There ended up being a huge seizure, search warrants, and arrest to follow. But it was really good to work with those folks because you learn a lot of stuff that we don't see on a daily basis. Hopefully, vice versa. And then there's an introduction of other places like revenue services that surprisingly came out of nowhere and helped us take down a business that was endangering children. So I just wanted to add that.
That's great. Yeah, we don't need a warrant. Our laws allow us to show up during regular business hours at any permitted location, anytime to inspect. We don't even need a reason. We can just show up and inspect. So we are able to get into places quickly and efficiently. So, and also to your point, DOL, Department of Labor, also very helpful getting into locations and premises for labor violations, and they can also instantly shut down a premise if they do discover labor violations. So they are also a really good tool in investigating problem locations. Good point.
Thank you.
Thank you.
Any other questions for Caitlin? Seeing none. Okay.
Thanks so
Thank
much.
you very much, Caitlin.
Appreciate it.
Several of us will probably be following up with you after this.
That'd be great. Thank you.
Yep. Okay. Next, we're going to move on. We're going to hear from Department of Mental Health and Addiction Services, or DMIS, as we say in state government. Julianne Giard is the Section Chief of Community Services. Julianne, I will turn it over to you. If you're talking, Julianne, just need you to unmute.
Thank you, Commissioner. Thank you for inviting DMIS to be part of this important conversation. Next slide. So I'm going to go over DMIS substance use services kind of at a high level, and then get into some detail around our prevention services, pretrial intervention program, and our media campaigns. So an agency snapshot, DMIS is the lead state agency for adult mental health and substance use services. In FY23, DMIS, the whole DMIS system served over 93,000 individuals, cross prevention, treatment, and recovery support. And we do prevention services across the lifespan. So that's an important note. In terms of residential or inpatient programs, there's a summary there of the number of beds that Demus either operates or funds. And we certainly operate services, but we also contract with over 130 private nonprofit agencies to provide these services. So we really focus on access and lowering any barriers to the services that are available. So there is no wrong door to access the Demus behavioral health system. There's numerous points of access. So we have multiple 24/7 lines. One is specific to substance use services that we call the access line. And then through the United Way, we fund the 988 center as well as an action line, which we started before 988. And you can see by, the thousands of calls each month that come into those lines. We also built some online resources. So at ctaddictionservices.com, it gives people, the public, real-time information about withdrawal management services. We used to call that detox, and substance use residential treatment services, as well as others. And we also have a mentalhealthservices.com site as well. Overall, we have 13 local mental health authorities, each with a catchment area that covers the state. And we have the substance use programs are really statewide programs. They're not really driven by a catchment area. So anyone can access any of those programs statewide. Next slide. So programmatically, wanted to talk about substance use services a little bit. So over 230 actual substance use programs, and one SUD facility with hospital level of care, which Demus operates. And in FY23, over 46,000 individuals were served in the substance use system of care. So we have treatment delivered by licensed clinicians and licensed programs across residential, outpatient, intensive outpatient, and medications for substance use or addiction treatment, methadone, buprenorphine, naltrexone. And we're also working to make some of those mobile units. Support services, so non-licensed, but very important services, recovery centers, case management, naloxone, providing transportation, and recovery. People who have lived experience helping others who are looking to get into recovery. So recovery coaches, sober housing, a free telephone recovery support program, outreach and engagement. And we have a particular program where all of the hospital emergency departments in the state participate in a recovery coach program where anyone that comes to the emergency room with at least in part a substance use issue, if they would like to speak to a recovery coach, the ED contacts a centralized number and a recovery coach is dispatched to the ED. So that's been a really successful program, achieved 90% connection to post-hospital services. Peer supports are integrated at every level of Demus service. Next slide. Just wanted to mention that the majority of individuals we see in services have both a substance use and mental health condition. So we really focus on integrated care, treating the whole person, and making sure that our programs are co-occurring, what we call co-occurring capable, because so many people have both conditions. And we have a number of services for special populations. At the bottom there, you can see we have programs for pregnant and parenting women as well. Next slide. So to go into a little depth in some areas, our Prevention and Health Promotion Division, the director is Sarju Shah, is designed to promote the overall health and wellness of individuals by preventing or delaying substance use. And they work with individuals and communities, utilizing primary prevention strategies to reduce alcohol, cannabis, and other drug use. And next slide. So there's some facts there about the impacts on the left, and then the prevention division has a couple of specific initiatives. 10 prevention in Connecticut communities, PCC, 10 community coalitions working on this content area and partnerships for success. 12 community coalitions. A lot of the prevention work is federally funded, and so you'll see that there are timelines there for when these different projects are funded, although there's usually opportunities to continue that. And so this team is really has a number of strategies to reduce underage drinking, including making alcohol less available to use, enhancing enforcement of laws of alcohol sales to minors, raising awareness of alcohol-related harms. Next slide. So this report here that you see, Sober Truth on Underage Drinking Act, Stopped Act, survey our prevention division participates in. It's a report that provides national and state data on the policies, programs, and practices related to underage drinking prevention and treatment. And DEMIS is the lead agency for survey completion with support from DCP. A lot of interagency work, and the things that we work on, we work with DPH, DCP, and I'll name others as we go along. Next slide. So the two initiatives I mentioned there are implementing evidence-based strategies and reducing access to alcohol on 12 to 20-year-olds. So media campaigns, social marketing, coalition and capacity building, training and education, policy change, enforcement, youth development, data collection and monitoring. So really coming at it from a number of different ways. Next slide. The cannabis campaign, it's called Be in the Know. We've been working with Sarju and her team and DPH has been part of this, working with the O'Donnell Company to launch this. And it's really focused on increasing the knowledge of laws related to possession and use of cannabis in Connecticut, increasing knowledge of the impacts of cannabis among target populations, and delivering prevention messages and strategies, services and support related to cannabis misuse. Next slide. So the statewide cannabis education and awareness campaign, a little more information here, and key messages connected to impaired driving. They've done a nice job with this, and we'll see some of the creative that's been used. Cannabis use in adolescent brain development, safe storage of cannabis, the risks of using cannabis while pregnant or breastfeeding. Next slide. So here's some of the creative of the Be in the Know campaign. The first one there, you can see driving after using weed is illegal. And you can visit the website beintheknowct.org. And the placements are wide ranging, listed there from billboards to gas station audio, as we do with all our campaigns. Next slide. So this is shifting gears a little bit to our forensics division. They administer a pretrial intervention program, and the text here kind of outlines the two components of that, the Impaired Driving Intervention Program, IDIP, and the Drug Intervention and Community Service Program, DICSP. So both of those comprise what we call PTIP. Both are diversionary programs offered by the courts. The statutes in there, and DEMIS contracts with 5 private nonprofit agencies across the state to provide evaluations and educational groups as part of PTIP. Next slide. So starting first with the Impaired Driving Intervention Program, this program is available to adults arrested for the first time for operating a motor vehicle or other vehicle under the influence of alcohol and or drugs. It's also an option for those individuals previously arrested for these offenses, if it was over 10 years ago without any intervening arrests or convictions. So the details are there. Next slide. The second part of PTIP, this program is available to persons arrested for possession of drugs or drug paraphernalia. The program may be used twice and with the court's permission a third time. It includes a community service component that is managed by Court Support Services Division or CSSD of the Judicial Branch. So the requirements for both of these components are the same. Clients are referred for an evaluation to determine the appropriate level of care. If the recommendation is the 12 educational session groups, the client will be referred to a PTIP contract agency. If the recommendation is substance use disorder treatment, they will be required to complete 15 sessions of the recommended treatment level. Next slide. So this is a little bit more about the educational group. If clients need a higher level of care, they can be ordered by the court to complete those 15 sessions. It might be standard outpatient or intensive outpatient, partial hospitalization, or residential treatment. Next slide. Once a client successfully completes, a report is submitted to the court, and the client may apply for dismissal of the charges. Next slide. So here is one of our media campaigns called Live Loud, Live Life with Opioid Use Disorder. We work with the O'Donnell Company on this one as well. Next slide. So there's been a number of phases. This started back in 2018. And we continue to work with them. I think we're on phase 6 or 7, kind of using each phase to focus on different aspects. And Louisa Barnett is our Director of Opioid Services, and she is going to be looking at impaired driving next. So we really welcome the collaboration with DOT and others on that. Next slide. Here's some of the creatives that have been used in a variety of mediums, social media, digital billboards, etc. Next slide. I work on the alcohol use disorder campaign with the O'Donnell Company. This has been a multi-phase project as well. We're currently in phase 3, and Eric Scoville from DOT is part of the work group, so we appreciate the direct input from him. Next slide. So there's a website associated with this campaign, ctstronger.org. You can check it out. You'll see a specific section of that on alcohol use. And then we added under personal safety a piece on impaired driving. So getting some content out around that. Next slide. So this is some of the creative that has been developed through the alcohol use campaign and used in a number of places. And so that was a quick overview of a number of areas that we've been trying to come at this. You know, our main mission is the services part, treatment and recovery and prevention. And media is something relatively new that we've developed a number of campaigns, and then of course our forensic services. So happy to take any questions.
Thank you very much. And we will share all the websites shared today on our Vision Zero website, so members of the public and other Vision Zero council members can access them. I did have just a couple quick questions. One, at the beginning you talked about there were like 3,500 calls per month on the access line and 10,000 calls per month on 988. I'm assuming the 10,000 calls for 988 are not all tied to impairment. It's just everything 988, or is it like substance use issues specifically that you referenced?
Yeah, good question. So 988 and the action line are more mental health focused, people who are more in mental health crisis. Certainly if someone calls and they're experiencing some kind of mental health and substance use or just substance use, again, we don't turn them away. They do the best they can with the call, but that is intended to be more mental health focused, the 988 action line.
Yeah, because 988 is also where we direct people for suicidal issues, right? Okay.
Yeah.
And then on the cannabis ad campaigns, the creative that you were going into, do you also, we've been working with the Chamber of Commerce, the Cannabis Chamber of Commerce, to place some of our creative in the actual dispensaries. Is Demas doing that as well?
Not that I'm aware of, but I will
Okay.
take it back to Sergio. That's a great
Okay.
idea.
Great. Thank you. Any other questions for Demas? Nothing? Okay. Well, we'll make sure all of this is posted after the meeting, including the website. I appreciate all the efforts everyone at Demas, as well as all the nonprofit providers are doing to address this. I know you did talk about the Live Loud campaign. You know, what we are seeing in some of our wrong way crashes is, as Flavia talked about, a lot of them, almost every one of them is alcohol, but plus like about half of them also have other substances, and a lot of the focus is on cannabis in our state. But what we're seeing is there is a lot of opioids, fentanyl in the system. So it's a serious issue, as many of us know. So thank you. Okay. Thank you. And now we're going to move to Department of Public Health. So Susan, I'll let you introduce your colleague.
Sure. So, my name is Susan Logan. I am a supervising epidemiologist in the Injury and Violence Surveillance Unit here at DPH. And you can go on to the next slide. And I just wanted to just give you a little bit of an overview of the work that we're doing here in our section. So Allison Codner, I work in the Injury and Violence Surveillance Unit. Allison works in the Chronic Disease Epidemiology Unit, and they oversee the cannabis program. So Allison works on the cannabis program. So, so we are both staff in the Community Family Health and Prevention branch. We're both co-located in the Chronic Disease and Injury Prevention section. So I'm working, like I said, at the Injury and Violence Surveillance Unit. And we not only look at motor vehicle crashes, we do surveillance on many different areas in injury and violence. We monitor transportation-related injuries, but we also monitor injuries related to falls, concussions, traumatic brain injuries, intentional violence, such as suicide, homicide, and sexual violence. So we currently manage a number of grants related to these topics, which are funded by the Centers for Disease Control and Prevention. And several of those are related to overdose. It's called Overdose Data Action, as well as the Connecticut Violent Death Reporting System, the Rape Education and Prevention Grant, and finally, the Comprehensive Suicide Prevention Grant. So all of these, this funding is by the CDC, so we're able to work on these particular topics in public health. So for Allison, like I said, she works in the cannabis program, but she's also associated with the Comprehensive Cancer Program because it is a chronic disease epi unit. So Allison is involved in monitoring for cannabis adverse events and injuries related to cannabis exposure. But she also focuses on chronic disease, such as cancer, but that unit also focuses on asthma, diabetes, heart disease, and stroke. So just wanted to give you a little bit of an update on that. So for our unit, we just give you an overview of the work we're doing related to transportation-related injuries. So we provide epidemiological support to our DPH Office of Injury and Violence Prevention. So in our section, we not only have an injury and violence surveillance unit, but we also have a prevention office, which is related to injury and violence prevention. So we pretty much work hand in hand with each other. So the data side will provide surveillance and epidemiological trends. We identify disproportionately affected populations, populations at high risk, provide that information over to our Office of Injury and Violence Prevention, and they take action and do work with on a statewide level or at a local level with local health departments, harm reduction agencies if we're looking at overdose prevention, in different agencies throughout the state to provide prevention initiatives. And a lot of that work is based on the data that we provide. A lot of their focus areas are on the data that we provide to that office. So as far as transportation related and data, so DPH has a memorandum of understanding with the Connecticut Transportation Research Center at UConn. We send data annually to the Connecticut Crash Data Repository for them to link their Connecticut crash data with the emergency department and hospitalization data, with the emergency medical services data, and with trauma center data. So we send that data once a year or more if they would need that as part of the MOU to the UConn and linking to the Connecticut Crash Data Repository. So along the way, we built partnerships with many different agencies and organizations, some of which are Department of Transportation, the Connecticut Traffic Safety Research Center at UConn, the Traffic Records Coordinating Committee, DEMIS, and DCP. The latter agency, pretty much we work with DCP on is the Prescription Drug Monitoring Program, looking at the prescriptions for opioids and benzos and other things that are involved with addiction. So we also have appointments to the Vision Zero Council. We have program staff sitting on the council and several subcommittees of the council: equity, engineering, education, and enforcement. Our Office of Injury and Violence Prevention is appointed to the Alcohol and Drug Policy Council. And within that council, there is a cannabis work group, which is part of the prevention subcommittee. And also, finally, we have DPH appointments to the Connecticut Highway Safety Plan Executive and the steering committees. And with each of these activities and appointments, we are promoting an evidence-based public health approach to transportation-related injuries and deaths. So next slide. Okay, just gonna make sure I'm on the right slide. Yes, so for this slide, I just wanted to just give you kind of like a sense of some of the work that we're doing. We do have a web page on the DPH portal around traffic and motor vehicle accident prevention program. We do create fact sheets around motor vehicle injury, so those are available on our web page. And we have a new fact sheet coming out soon using 2023 injury data on motor vehicle crashes coming out probably in September of 2024. Next slide. Allison will be talking about the cannabis program next. And so we're going to kind of go back and forth with our slides because we have a intermix between the work Injury Violence Surveillance Unit does and the work that the cannabis program does.
As an EPI with the cannabis program, the cannabis surveillance program at DPH was created by the Public Act 21-1. The legislation basically requires that our program creates an annual report related to public health statistics related to cannabis, and these reports can be found on our website. On top of the yearly report, we also present our findings to various prevention work groups like the ADPC, or as otherwise requested by programs. You can go to the next slide.
So I'll be talking about some of the work around alcohol and other substance risk behaviors and injuries. So next slide. This should show alcohol, the questions that are on the behavioral risk factor surveillance system survey. So there are 2 questions. Well, first of all, let me just give you a little bit of background of what about the behavioral risk factor surveillance system survey. It's an ongoing telephone survey of adults all conducted in all 50 states. It is funded by the CDC. The households are randomly selected, and then once the interviewer reaches a household, they ask that they randomly select a member of that household who is an adult to provide information on the behavior of that adult related to anything, job satisfaction, depression, mental health, income. There's a whole bunch of different questions being asked related to high-risk behavior, several on drinking, and also they're heavy drinkers or binge drinkers. And then there's questions on drinking and driving. So these 2 questions here are related to drinking and driving. So question 9 here talks about, have you ridden in a vehicle driven by someone who has been drinking alcohol? And the second question, number 10, is how many times the respondent has driven a vehicle when they had been drinking. So the first question was, how many times did they ride in the vehicle? And then the second question was related to how many times did they drive the vehicle after drinking alcohol? Next slide. So this looks at the U.S. Like I said, it's all 50 states. The BRFSS survey is done, and in this state, Connecticut seems to actually, based on the respondents, have a lower risk of saying that they drove after having too much to drink. So again, this question pertains to people driving after having too much to drink. So for instance, in Connecticut, we are like the lightest range there, from 1.3 to 2.1% of adults saying that they had driven after they've had too much to drink. And the rates across the US vary between the lowest of 1.3 all the way up to 8% saying that they drove after having too much to drink. So if you look at the whole map, this is Connecticut seems to be one of the lowest rates for the states. So, that's in contrast to what some of the other data that we've seen today about Connecticut being really high at risk. But so you have to kind of take it with a grain of salt, because these are questions that the adult is answering through a survey, through a telephone survey. So you always wonder if they're always, being, kind of like underreporting the work that, underreporting the drinking that they are doing and driving at the same time. So just wanted to point that out. And on the other slide, it's kind of, the next slide is related to people who said that they had not driven after driving too much, after having too much to drink. So in this case, Connecticut looks really good. About 98% of respondents are saying that they did not drive after having too much to drink. So we're looking good on that and the spectrum too with regard to this survey question. Next slide. So here, this is actually a different survey on teen alcohol use and driving statistics. This is the Connecticut School Health Survey. Now this survey is done statewide. It's done every other year, and they go into the randomly selected high school. And then within that high school, they choose it's a randomly chosen classroom to do the survey. And not a lot of high schools like to do the survey because it does spend time, like, very, urgent, like there's a lot of additional things that they don't want to be doing. This is considered additional for some of these high schools, kind of interferes with with their academics and the work that they want to be doing. So we had some difficulty in getting high schools to cooperate, but there was a recent statute that came out, I forget what year, it was last year or the year before, where if a high school is randomly selected, that they are mandated to comply with giving that survey, because a lot of folks would be randomly selected, but they didn't want to comply with the survey. So with providing that survey to the students. So so it's actually gotten better as far the last couple of years, as far as now when a high school is randomly chosen, that they do have to comply. So in this slide, you see there's some results that related to high school alcohol use and driving. So here you see the left side, it indicates 2021 data, and it looks at the percentage of high school students who rode with a driver who had been drinking. And if you look at statistically significant rates, females were significantly higher than males. And then also Hispanic rates were significantly higher than white rates. So you see here in this chart that you are seeing females riding who would be more significantly different. So that might be some population that you might want to educate, and as well as Hispanics also having higher rates. And so focusing some of your prevention efforts in that population would be important. So on the right side graph, showing data results from the same question, but this data is looking at over time. And we're looking at as early as 2005 through 2021. And as you can see, the percentages of people riding in cars or vehicles with someone who'd been drinking has decreased between 2005 to 2021 from 29.7% to 12.3%. And there also was the question was asked in 1997. You see there was 38.3% of people saying that they had driven in a car with someone who had been drinking. So it really has decreased over the years, which is good to see. Next slide. So this one was related to people that teens that were driving after having too much to drink. We don't have a lot of information on folks on the leftmost chart because not a lot of high school students are driving until they're in their junior and senior year. So a lot of there's not a lot of statistically significant data here. So we can't really say a lot about the leftmost chart. But for the right graph, it does indicate percentage that was significantly decreased. And you see the linear trend between 2013 and 2021. In 2013, it was 9.4%. And in 2021, it was 3.2% of high school students saying that they drove a car or other vehicle when they had been drinking alcohol. Next slide. So Allison's going to talk about the cannabis burden and the use and risk behaviors.
So part of the legislation requires us to report on any cannabis-related adverse events like poisonings, injuries, illnesses, as well as describing the overall burden of cannabis use in the state. And most of our data comes from surveys or hospitalization records. Next slide, please. So just to briefly overview some of the BRFIS data that we have, which is the Behavioral Risk Factors Surveillance Survey, 16% of adults used cannabis in the past 30 days in 2022. Cannabis use is consistently greatest among those aged 18 to 34. And most report using cannabis for either non-medical reasons or both medical and non-medical. Next slide. So approximately 1/3 of cannabis users obtain their cannabis from medical dispensaries. 76% reported smoking as their primary method of consumption, though the prevalence of eating or vaping cannabis has been increasing over time. So that's a trend we've been watching. And then we found that 1 in 5 reported driving within 3 hours of using cannabis for those who have used cannabis in the past month. This proportion, again, was greatest amongst those 18 to 34-year-olds. Next slide, please. So another data source that we use is the National Survey on Drug Use and Health, which is conducted by SAMHSA. And according to this survey, 20% of individuals 12 or older have used cannabis within the past year. 18 to 25-year-olds in particular have the greatest prevalence of past year use, as well as past year initiation of cannabis use. But they also have the lowest perception of risk from using cannabis than any other age group. You can go to the next slide. So just going back to the BRFIS data, the survey included a single question on driving under the influence of cannabis within 3 hours of using cannabis. So we performed a generalized linear model, and we found that individuals who were 18 years old, male, non-Hispanic, Black, and excessive drinkers were more likely to drive under the influence of cannabis. And so those were some predictors. You can go to the next slide. So these are just some screenshots of some of the information that is included in our annual report and supplements, and it's more comprehensive results in specifically related to driving under the influence. You can go to the next slide. So this slide just basically summarizes our BRFIS findings related to driving under the influence and some of its limitations. Again, approximately 90% of past month users drove under the influence of cannabis. And this question in particular will be included in future surveys, so we'll be able to see trends over time. And next slide. So these are just some of the fact sheets and posters that we presented related to cannabis use that our program has created. And these can be found on our website as well. So there's several challenges and limitations to our data. There's limited data available on driving under the influence. That one BRFIS question is pretty much all we have related to cannabis and like other substances. The data we do have is survey based, so there's a lot of limitations to survey data, and our hospital data may not always be complete or adequately coded. Additionally, there's a lack of standardized identifiers across databases, so we can't follow individuals or incidents across databases.
And then also I wanted to mention that there is gaps in funding to DPH for injury surveillance around transportation-related injuries and the public health approach for prevention. So because of this lack of funding, we have reduced personnel. And also our data sources can be limiting. And so we would need better data sources that accurately measure drinking and driving other than just the BRFSS and the YRBS. We'd like more detail in the medical records on the substances that people were exposed to. Right now, we only have the substances after somebody died. We don't necessarily have a lot of information on the substances that people were using for a non-fatal injury related to a crash. And we'd like more emphasis on the public health approach to preventing or reducing impaired driving, which really comes down to using the data, but also determining the root causes of their behavior. What are the risk factors that can be addressed and reduced around transportation-related injuries? What do we do about these risk factors? And what are the protective factors? What are people doing or not doing that reduces their risk of impaired driving and related injury and death? And some of that gaps in funding has to do with we haven't been able to get a core grant. We have a core, the CDC has a core state injury prevention program grant. And one of the major focus areas that I've seen over the past few grant cycles is transportation related injuries. So this core grant it's called a SIP grant, which is the Injury Prevention Program grant. It's a 5-year grant. And it does provide resources to build the infrastructure for the state's injury and violence surveillance prevention programs. So we applied for it in 2021. We weren't able to get it, but there is a new grant cycle in 2025. So we hope to be able to get that and hopefully provide the opportunity to get funding to really monitor and do a better job of monitoring and preventing transportation-related injuries on the public health side. Next slide.
So some of our next steps for the cannabis surveillance program is looking at cannabis use during pregnancy, cannabis-related mental health visits, and cannabis-related poison control calls, as well as looking at cannabis hyperemesis syndrome.
Right. And the other thing that we would like to do is really monitoring the alcohol use involved, emergency department visits and hospitalizations, excuse me, creating a subset for motor vehicle related injuries. We also want to look at other substance use involved EDs and hospitalizations and motor vehicle related injuries, and not only looking at alcohol, but in cannabis, but also other substances such as cocaine, opioids, benzodiazepines, PCP, etc. We also want to be able to look at the types of injuries related to substance use and alcohol intoxication, but also the severity of those injuries, because it's always interesting to see based on the injury, the motor vehicle crash, how severe it is. Are they just going to the ED and being discharged? Or are they being hospitalized? The length of time that they're in the hospital and different procedures and diagnoses that we can glean from that. That's it for us. Thank you very much for this opportunity to present to the council, and let us know if you have any questions.
Thank you, Susan and Allison. Right, allergies are rough today. So I was Allison, the numbers you showed, nearly 25% of 18 to 34-year-olds reported driving within 3 hours of using cannabis is much higher than I was expecting. It's kind of scary, but I'm glad that you call it the BRFIS, right? Is that the acronym? That you're going to continue asking that question each time, because I think, what Susan, you showed, that trend line down of people getting in the vehicle, teenagers getting in the vehicle with someone after they've been drinking, shows that the alcohol education has been working in high schools. So hopefully we can see the same progress on the cannabis side, because admittedly, family members, I come from a very large family and a lot of young family members, and they are under that myth that you drive better when you're high because you drive slower and you're more careful. I was like, no, you don't. So there's a lot of myths out there we need to pop the bubble on. So any questions for DPH? And the data gap too. This is something I keep bringing up. We don't know what we don't know. So we don't actually know what's happening on the roadways. The fact that, it's much easier, it's more expensive when you take someone into custody and do a full battery of tests to determine everything in their system. If they blow a 0.08, it's easier for the officer to just, charge them with alcohol impaired driving. So, finding more details on what's actually involved in the driver's system is going to be critical for us to actually address what's happening on the roadways. So, okay. Thank you both. I appreciate it. And we'll share all this information on the Vision Zero website after this meeting. So, Aaron, I'm going to turn it over to you. Aaron, you need to unmute.
I'm here. Takes a little while to get everything back up and running. Thank you, Commissioner. So, I went one too far here, excuse me. At the last meeting of the Vision Zero Council back in March, we heard brief updates from all of our subcommittees, kind of wrapping up what they had done the previous year. And the council at that time gave some guidance to our subcommittees. And that guidance really was to make sure to meet again prior to this meeting, start to set some priorities for the year, and continue their ongoing discussions that they're having. So we're just going to hear from each of the subcommittee chairs from each subcommittee, a brief update as to what they've been working on. So we'll go right in order with the list we have here. We'll start with engineering. Chuck and Natasha, if either one of you wants to give an update, we'd appreciate that.
Good morning. This is Natasha here. The engineering subcommittee met on May 8th, earlier in this year, and the whole group was there. We went over a brief update of the legislation that passed in the 2023 year, and kind of as we had some items in that legislation, so we wanted to give our members a status of that. And then we discussed our ideas that were sent forth in the legislation report for 2024. And then we concluded our discussion with the next steps, which would be to come up with new strategies or strategies that maybe didn't make the report, and can maybe fine tune those and see if we want to pursue them. So we anticipate having another meeting in the month of August to go over the strategies that we have talked about, any new initiatives that people have, And then from there, we would prioritize those.
Thank you, Natasha. I appreciate that. I think we'll save questions and guidance, any potential guidance from the council till after all of the updates. So we'll just get right through this. From enforcement, I saw Terry was here. Terry, do you have an update?
Yes, I'll try to be quick. Thank you. Similar to what engineering and the other subcommittees are doing, we met on May 24th to discuss all the safety related legislation during the most recent session. We're looking to continue to push the legislation that did not pass. Some of them were to do with the blood alcohol level. We want to see that go to 0.05. We're really want to have a discussion further on that to get that through. And blood saliva testing and e-warrants, we really think we need to make some progress on that and do what we can. There is a pilot program in place right now. So we want to see what happens with that pilot program that I think Kevin McNeil from Highway Safety Office is involved in. We want motorcycle helmet requirements and reckless driving violations for distracted driving. We want to resubmit that bill. We think that it was removed under House Amendment A under the Public Act that did go through under House Bill 5330. There's another bill, an act establishing secondary traffic violations that did not go anywhere. It was Senate House Bill 5324. We would like to monitor that. We have some concerns with the language that is in there. And also we want to propose a meeting of the Vision Zero Council and maybe the Strategic Highway Safety Plan Executive Committee Commissioner. I know you're probably on both of those. And just to make sure that we're in alignment with what is going on between Vision Zero Council and the Strategic Highway Safety Plan. Many of us are on both committees, and I think we have a common goal in both sides. So that was a suggestion that came out. And also a recommendation to assist in engaging insurance companies to get their take on it and what's going on and what their concerns are. I think that they should be a stakeholder in all the committees. Open container law, I didn't put that on my list, Aaron, but open container law, I think we should still continue to try to pursue the legislation on the open container law. I saw from everybody that spoke today, it's a big concern. So I think people that maybe aren't drinking and driving, but are driving or have people in the vehicle drinking, how many drivers are actually partaking in the drinking with the others and where that is. So I know, Susan, I don't know if there's a way to make a survey on that. That would be great. And as we said before, Enforcement Subcommittee wants to make sure that we are involved with all the subcommittees. We support all of their strategies, and we also support everything coming out of the Strategic Highway Safety Plan emphasis areas. That's it for me.
Thank you, Terry. I know you guys have all been working hard. And really that goes for all of our subcommittees and their chairs too. So just a quick note. Up next, we're going to hear from Equity. I think Alec is here today.
I'm here. Hello, everyone. So the Equity Subcommittee met a couple weeks ago, and we chatted about a few different topics, and I'll start with the ones that are related to impaired driving. I know there's been obviously talk at the council and elsewhere about the police phlebotomy program. I think one thing that we heard is just to continue to make sure we're tracking that as part of the racial profiling data that's collected at the roadside, and make sure to engage with the Connecticut Racial Profiling Prohibition Project Advisory Board on that, and also just making it very clear what the chain of custody is, the drugs that will be tested, just so folks not only who are being tested by police phlebotomists, but also out in the community are aware of exactly how that works. And then what we talked about prescription drugs in driving, and a lot of the warning labels right now don't operate machinery, which of course a car is a machine, a heavy machine. So it would often fall under that. But I think, there was talk about, hey, maybe making that more explicit so folks really get that in their head, whether it's pictures or words, or just wanting to make sure that we encourage folks to get the information about how medications can affect their driving, whether that's via warning labels, via talking to pharmacists or other healthcare providers, and making sure that the why is explained, and trying to make sure we do that among all communities. Obviously, not every medicine is going to affect driving, and some medicines might affect driving, but might not. So we want to make sure people have the personalized information that they need. I know that there has been talk about trying to expand access to driver education, and that's something that we discussed as well. I don't think we have the secret sauce figured out quite yet, but that's certainly something that we're interested in pursuing, and trying to dig a little bit deeper into information about where people are taking driver education when they're 16 and 17-year-olds, and where they're not. So that's information that we're going to try to figure out. And then the last thing we talked about at the meeting is, I know there was a bill in the legislature related to the ability, or I guess inability, of DMV to suspend someone's license based on the failure to pay or failure to appear in court for a traffic ticket. I know the bill did not pass. I think, certainly the goal there was equity, and we want to make sure we're not suspending licenses based on someone's inability to pay. The equity subcommittee agrees with that intent. I think from the traffic safety side, we want to make sure if someone truly just doesn't respond and ignores a ticket entirely, there should be some consequences. So whether it's community involvement or community service as a way to get out of paying a fine, or having some sort of payment plan, or offender classes or diversion programs, wanting to make sure that if a bill like that were to go forward again next year, that contains some of those provisions to make sure that we're achieving both the equity and traffic safety goals. And that's what kind of the summary of the discussion.
Thank you, Alec. Again, we appreciate all your work on this effort. Last, we have education. I believe I saw all Ernie, Sean, and Amy here. I don't know if one of you is.
Yep, it's me, Amy. Hi, everybody.
Hi.
So the Education Subcommittee met on May 13th. We got some updates from our advocates, including about the DOT Work Zone Safety Committee, of which just celebrated 25 years. And they have a media campaign, including PSAs, a brochure, and a website, and they attend public events and have an annual contest. So if people are interested in work zone safety, there are some resources. There's also been a new video released by the DOT about I think it's DOT, it could be DMV, I think it's DOT, about what to do if you're pulled over. So kind of aimed at teens. So I'm going to teach them about how to interact when you've been pulled over. And that was shown at the road safety conference that was held a couple weeks ago. So that's worth looking at. We talked about a few of the new key topics, the driver's education that we want to explore, free or reduced cost education. We know that other committees are also interested in this, so that may be something that to explore. Around the blood draw proposal that people are talking about, there may need to be an education campaign to go with that, or maybe ahead of that, for the public to understand why it's needed and how it's going to be performed, et cetera. There's a lot of misinformation. We might want to get ahead of any kind of, people being upset about that by educating. And then finally, the impacts of prescription drugs on safe driving. We had come up with an idea of exploring a requirement that anyone refilling or filling a prescription for drugs that impact their driving must talk to their pharmacist. or so if they're, or even if they're just changing a dosage, that they have to meet with the pharmacist and get that little bit of information. So that's an option for addressing that issue. So as far as updating on the implementation of the law that was passed, the DMV is working on the Vision Zero mandated license renewal video. So that vendor is secured and the work has begun. So that was part of the law that the DMV create a video to educate people about new laws and safely riding around vulnerable users. And finally, our Vision Zero bill did have a section around a Vision Zero program of distinction, which has so far been implemented through Safe Routes to Schools at the DOT. Kristen Levesque did a great job with that. She has moved on to another department in the DOT, which we're very sad about, but she's leaving it in good hands with Anna and her team. So what she has recommended was that based on what she's experiencing through the implementation, she's made some recommendations for changing in the wording of the law. And those proposed changes are inclusive to help eliminate the barriers to application and access to the program. And what she has found is that school administrators are the primary applicants, not the Board of Education. And she wants to apply it for K through 12, so all grade levels, because often a school will apply for their entire school district. So I have, and I will send to you, Aaron, and you can distribute the existing law and the changes that are being suggested for that section of the law. And you can decide to accept or reject those changes as provided. That's all. Thank you.
Okay.
Thank you so much.
Thank you. Yeah, thank you all. Any comments or questions from committee, council members? I will say, you know, I think clearly the subcommittees are doing quite a lot of work here. Appreciate all the work and effort that's going into this. I think 2 quick points from my side is it'd be great for the September meeting, which Aaron will talk about in a few minutes, to have each subcommittee be able to basically wrap up what your recommendations are for this calendar year so that we can work towards hitting the goal line for the legislative session that kicks off in January. But I think as we heard with some of the presentations from DPH, DMIS, DCP, and DOT today, I think, you know, if each of the subcommittees could look at where are the gaps and limitations in some of the data available that can help us improve safety, and what can be done to close some of those gaps, or at least begin to address that. What tools are necessary, what practices are necessary to help close some of those gaps. I think, you know, I keep going back to, we can't solve or begin to identify solutions to our problems if we don't know what the actual problems are or what's causing the problem in reality. So appreciate if each subcommittee could noodle on that, identify ways we could potentially address the data gaps there. So, okay. Seeing no other hands, Aaron, I will turn it back to you.
Thank you, Commissioner. Okay, so for us, we have our next steps. Excuse me. And what we're looking for towards the end of the year, as the Commissioner alluded to, there's 2 meetings left of the council. Seems like that happened pretty fast. We're gonna meet in September and again in December. Amy brought up the Vision Zero Schools of Distinction program. Again, another tip of the cap to Kristen and the work that she's done on that program. I agree with Amy. That program will continue to be well stewarded under Anna and her team. One thing that we met about and that we're working towards, there were actually 4 different schools or districts that applied this year to be part of the Vision Zero Schools of Distinction program. They were accepted, and the thought is that those schools or districts should be should be recognized formally in some way. So I've asked the commissioner if it would be okay if we would have some sort of a ceremony, probably at DOT. We'll keep council members informed as to how that's coming together, so that you can participate in that should you wish to. But that's something that we're looking for in September, to be able to actually recognize the schools and districts that want to be a part of this. For the next September meeting, something that the council, at the March meeting, the council identified some of the priorities for the year. Obviously, this meeting focusing on impaired driving, and hearing some perspectives from some of our other state agencies that don't sit on the council. That's what we did today. One of the other things we heard back in March was that we might like to hear a little bit what's going on at the local level with Vision Zero efforts in Connecticut, because there are several of those happening. I'd put it to the commissioner and the council. If that's something you want to hear, let me know and we'll get that set up hopefully for September. And again, it sounds like in September, we'll hear some final or, like draft proposals from our subcommittees as well. So that's what we have to look forward to. Any other notes before I move on to the public comment portion of the meeting?
No, the only thing I'll add, Aaron, is on the local piece. So I think like you and I, if we are going to add that to the agenda in September, you and I are aware of like some municipalities that have local efforts underway, either through the press or through those communities talking to us. But if there are some smaller communities we're not aware of that have Vision Zero efforts underway that members of the public are aware of, or council members, please do transmit that up to us, because we'd like to get a diversity of local report out.
Agreed. We know there's some things going on, but I don't think we have a good handle on everything that's going on Vision Zero at the municipal and regional levels. And I think the council expressed a desire to connect with some of those efforts. So we'll try to learn what's going on out there. Okay. We can move to public comment. Just remind everybody of the rules for public comment. Please, if you have a comment, please, you may do so. You can raise your hand in the participant pane. You can also use the question and answer field at the bottom of the participant pane, and we will prioritize in-person comments ahead of those entered into the Q&A field. I do see one question from Roger. Who are the 4 schools awarded the Vision Zero Distinction Awards? Roger, I don't have that in front of me right now. I know Canton was one of them, but I'll get that to you, or that's something that we can post.
Yeah, and Aaron, I mean, when we do award that to the schools in the fall, we'll do like a announcement around that. So.
Terry, you have your hand raised. Go ahead.
Thank you. Just a couple of quick things. I have a question regarding the liquor control, and it's directed at Caitlin. Large venues. I've attended as a sponsor some large venues, Live Nation and things like that. And I've seen some pretty risky behavior on the part of participants that go to concerts and some of these bigger events. How do you manage that, or are you have a presence there? I see a lot of people drinking even before they get into an event and coming into the events extremely intoxicated.
So that again sort of goes to our licensing issues. Our jurisdiction sort of extends to the 4 walls of the venue. In limited instances, we can sometimes connect activities that occur inside a premise and spill out, like a fight or shootings or whatnot, but most of our jurisdiction is contained to inside of the premise. So things that happen in the parking lot, we may not be able to address. But if someone is being served and they are intoxicated, that would be a referral. Again, like I described, where we would have to go and try to investigate if we could pull receipts, tabs, video surveillance, social media postings, videos, et cetera, to see if we could substantiate that kind of charge. I don't have the staff to post agents at every single event at the Meadows or the Excel Center or any of our other large event venues. We just don't have that capacity. So we do rely largely on self-reporting and referrals from PDs if there are issues.
Thank you.
Thank you. We have a question that came in through the Q&A. From Judith Proctor, red light and speed cameras were part of the VZ bill. Is there any data on communities that have adopted cameras?
I can answer that. So to date, ConnDOT has not received any applications from any municipalities. I know at least one municipality has voted internally inside their community in their local legislative body to approve it and to approve an application to ConnDOT, but it has not been received yet. So no municipalities have acted to apply yet.
Judith, you have your hand raised. You should be able to speak.
Can you hear me?
Yep.
Okay. Is there any way to somehow facilitate the process so municipal and move towards adopting the cameras?
So you cut out a little bit, but I think your question was about any way to facilitate the process so they can apply. ConnDOT has made ourselves available to any municipality that wants to discuss. So the ones that have been interested have been working with us, but they just have not actually submitted applications to us yet.
Okay, so as a member of the public, I my municipality to work on this.
Yes, yes. If a member of the public is interested, member of public should be pushing their local legislator, their local first selectman or mayor, as well as their local board of selectmen, city council, town council, representative town meeting, because it has to go from them to us. They have to take the first step. And so we have answered many questions from some municipalities and are helping them in the process, but it has to originate from them.
Okay, thank you.
Yep.
Not seeing anything else come in. We are just past time. We'll give folks just one more minute if anybody has a comment or a question. Okay, I don't see anybody else.
Okay. Thank you, Aaron. Thank you everyone for joining us today. We will make sure to get materials posted, including links to the various websites that were provided by our sister agencies. And thank you to the subcommittees who are going to continue working to finalize policy ideas as we move forward the next few months. Hope everyone stays very cool today and try to avoid going outside, please. Thank you, everyone. We're going to call the meeting adjourned.
Thank you.
Thank you.
Thank you.